I would love to tell you today a little bit about the project I'm taking care of for Healthcare Without Harm Europe, which is the Nurses Climate Challenge Europe. The idea behind the Nurses Climate Challenge is that health professionals have a role to play in the fight against climate change, because first of all, health professionals are trusted. Nurses have been voted to be the most trusted profession in many countries around the world, not only the UK. And we are caring for patients throughout their lives in all settings, and most of these patients are vulnerable or have many different illnesses and will be impacted by climate change throughout their lives. We should, as healthcare professionals, take a role in the fight against climate change, because climate change has a huge impact on health. And this is why we need to, first of all, learn and understand how climate change affects human health, and then work to decrease the healthcare's impact on the environment, and also to make healthcare resilient against the impacts of climate change, and prepare the patients who are at risk. The idea behind the Nurses Climate Challenge Europe is to educate healthcare professionals on climate change and health, and then build a cohort of informed and engaged health professionals in care settings, and launch a movement. I find it very important to have this cohort and this group of like-minded people and nurses who are also engaged to work against climate change, because sometimes it can feel like you're working all alone and there's nobody else doing things, and it helps a lot to talk to others and to know there's others who are working on the same. What we're doing is we're developing resources for any nurse who would like to join. And there's resources on different topics. First of all, learning resources. So to inform yourself, to learn about how climate change impacts health, and how healthcare also has an impact on climate change and the environment. Then there are education resources, which are mainly presentations to teach, and we're asking the nurses who join the Nurses Climate Challenge to teach their colleagues and other health professionals about this issue, and to help creating this movement. Then there are resources on advocacy to help nurses to get the courage to speak up and not only talk to their colleagues, but also to their own institutions. So maybe the administration or board, to their community, and possibly even to political leaders. Last but not least, we have some resources on nursing practice and how it can be made more resilient and reduce its own impact on the environment. And those are at the moment mainly case studies from successful projects of nurses that they've implemented already across Europe. Here you can see the number of educated nurses. We have just started in January, so it's like a huge success that we today actually have 870 nurses educated by other nurses. And on the right, you can see the map of all the nurses who have signed up, and it's amazing to see that they're from all over Europe, and that means we're also trying to get the solutions and all the ideas from everybody all around Europe together, because there might be a nurse. For example, one of the case studies is a nurse in Ireland who found a good way to reduce plastics in her anesthetics department, and I think we should learn from each other and collect all those amazing ideas and make it easy to implement them for everybody. Then the last thing we just launched in the last week actually is the nursing school commitment. It's not only important that the already registered nurses are learning about climate change and how to improve their care, but also the next generation, so the nurses that are now in school and starting to learn to be a nurse. And it's important to change the curriculum to include knowledge on planetary health, on climate change, and all the health impacts that come with it, and to give them the practical skills, but also the courage to speak up and find better solutions. At the moment, we have 10 nursing schools from all across Europe. 2 of those are from the UK. If you have any questions, I'm happy to answer, I think in the Q&A session, and you can always send me an email.
That's great. Thank you very much, Anna. Fantastic. And I should have said at the beginning, we're groups of people working on the kind of interface of climate and health. And we meet regularly, we share what we're doing, and we try and collaborate as much as possible. And many of us will be going to COP, and so some of the talks today will cover some of what's happening at COP, but some of them are just more generally about what we're doing. Kind of thought it would be useful to cover very, very briefly what a lot of the organisations in this area are doing, so that we don't, so that other people can find out about what we're all up to and join in. So thank you very much, Anna, for kicking us off. Mark, have you got your own slides?
Yes, I do.
Great, thank you. So Mark Baker from Students for Global Health.
Good evening, everyone. Thank you, Rachel, and thank you, Anna. 870 nurses in under a year is absolutely incredible. So it's great to hear about that. So I'm a medical student from the UK and a member of Students for Global Health. This evening, I'm going to talk a little bit about the work we've been doing this year on climate change and why we've chosen to focus on health and climate justice, and why we think other healthcare professionals should too. So Students for Global Health is a network of 4,000 to 5,000 healthcare students based across 36 universities in the UK. We believe, and we are aiming for a future where health is health equity for all, internationally and in the UK. For the last 2 years, we've chosen to focus the work a lot on climate change. And this year, the 3 main strands of our work have been working on different campaigns to get medical students, healthcare students, and healthcare professionals involved with climate change. We've been working on education, and we've been working on research, trying to understand what the UK's young people think about climate change in order to bring it to COP26. I just wanted to share 2 of the main lessons we've learned this year through this work about healthcare students. And the first lesson we've learned about healthcare students is that they are really passionate about climate change. Our focus at the start of the year was on the links between climate change and health, and we were really pleasantly surprised by how many students understood this link already. What the students didn't know, and they didn't feel empowered to do, was to take action. So our teaching throughout the year has actually changed to be more kind of power and political focused, in order for students to create local groups. We've had really fantastic stories of students working with local MPs and working with local medical schools to get climate change on curriculums. So we found that healthcare students all across the UK do care about this issue, just weren't sure how to get involved. And the second main lesson we've learned this year is that although there's lots of talk of marginalised groups being the most affected by climate change, we felt that many groups weren't taking action on this, and we really wanted to kind of live up to this. So this year we've worked a lot with Indigenous groups in order to take their voices to COP26, and we've been working with marginalised communities in the housing sector in the UK this year, because we feel that more organisations should be working with these marginalised communities, as they are going to be the most impacted by climate change. So all of this has taught us this year the importance of climate justice and health justice. So I'm just going to go over why we think these are so important. So ultimately, climate change is a problem of justice and a problem of power imbalance. High-income countries and large corporations overwhelmingly are responsible for climate change, whether that be the emissions they produce, the pollution they cause, and the exploitative relationship they tend to have with lower-income countries and marginalized communities. These rich countries and rich corporations then have the money and resources to protect themselves from the impacts of climate change, and the low-income countries that they've exploited and the marginalized communities they've forgotten are the most impacted by climate change. This relationship has been a huge problem since the Industrial Revolution, and it continues to be a problem today, which is why we believe in the need for a just transition. The just transition is a political idea that we believe should be implemented across the globe, and it works both internationally and nationally. And it promises three main things. Firstly, it promises that high-income countries and corporations fully decarbonize their economies. Secondly, that high-income countries fund climate action in low-income countries to protect them from the impacts of climate change. And thirdly, it's going so well. My apologies. That high-income countries and corporations pay climate reparations to low-income countries and marginalized groups in order to kind of pay back the massive damage that they've had on these communities. Now, climate change and health are incredibly interrelated, and health is also an issue of justice. Healthcare inequalities internationally and in the UK are a huge issue. And in the UK, we see massive outcomes in health based on someone's socioeconomic status. And that, again, is a problem due to power imbalance, where rich communities have more access to healthcare. And we already can see the impacts that climate change are having on low-income groups. We can see the impacts of high levels of pollution, poorer housing, and a lower access to green spaces and to green jobs. This system isn't working. It's not a balanced system, and that's why we feel that healthcare students and healthcare professionals need to demand system change. This is going to be a problem ongoing for many years to come, and it's not as easy as just saying healthcare workers must demand system change. We need to be there and see system change through in order to protect the communities we serve, so that we can protect their health, protect our health, and protect the planet. Now, in the run-up to COP, there are some actions that people can take in order to learn more about climate justice and hear more about these stories. Rob Abrahams from MedAct is going to speak more to these later on. But during COP26, on November the 6th, there's going to be a Global Day for Climate Justice. Going to be national protests, and there will be health blocks at these different protests. Find out more at the COP26coalition.org. And there will also be the People's Health hearing during COP26 on November the 7th. But I will leave it to Rob to explain that. After COP, we need to continue to work and make sure that the UK government is holding up its side of the climate deals. And we've done a lot of work on the Stop Camber campaign to stop the new North Sea oil fields. And we need to make sure that countries are holding true to their national determined contributions as set out in the Paris Agreement. So thank you very much. That's why we are working on health and climate justice. If you'd like to find out more, please do follow us on Instagram or Facebook at Students for Global Health CT. Thank you very much.
Thank you very much, Mark. And I'm just going to share my screen now because I'm going next. So as I said at the beginning, I'm Rachel Stancliffe. I'm the director of the Centre for Sustainable Healthcare. And we are a charity based in Oxford, working to some extent internationally, but certainly nationally. And our main focus is to make sustainability an integral part of clinical culture and service provision. And we do that in various ways. We try and integrate into the systems that are already part of normal medical practice and management and culture and education. So we are all familiar with this triple bottom line Venn diagram. So we look at environmental, social and economic parts to what's going on and parts of healthcare. We've tried to integrate those. So we've worked with the General Medical Council, and we've integrated those into what medical students are being taught and what they are examined on. So in order to do curriculum change, whichever country you're doing it in, we've set up a SHE network, Sustainable Healthcare Education Network, and we map existing learning objectives. We examine where we can integrate sustainability into those, and we strategize with students and others as to how to do that. So that's a network that anybody can join from any country in the world. You'd be very welcome to be part of what we've done already and to help us to take it forward. So another way that we work is to integrate into quality improvement, which is one of the places for change, I suppose, within the health system. So if you are looking at levers or kind of places that you can enter the system and make changes, then any opportunity for change is one of those. And quality improvement is a exercise that's done, I suppose, within most health systems in the world. So you look at something, pathway or an intervention that's done, and then you look at how you can do it better. And very simply, we look at those interventions in terms of the environmental, social and financial elements. So one of the ways in which we do that on the ground is with the Green Ward competition. And this is a competition run between wards within hospitals or hospital trusts. And very simply, the different wards come up with ideas for making changes. We help them to measure those changes and to see how they work in practice. So this is an example of one. It's about reducing cannulation. And you can see from, I won't read all of this out, but you can basically see that a lot of cannulation seems to be unnecessary in the hospital. And the percentage cannulated over a year almost halved when we did this intervention. And over £27,000 were saved in 1 year just from one ward doing this. And 8,500 kilograms of CO2 were saved. And as well as that, because we're interested in the social elements, staff time and patient experience both were improved. So you can see how you can begin to look at very practical ways of measuring sustainable change on the ground. And these are things that can all be written up as case studies and then shared via journal articles and so on. And we hope that they will be taken by people in different countries and copied. We also have a nice green space for health programme. So we started what we call the NHS forest about 12 years ago now. And the aim is very simply to plant one tree for every staff member of the NHS. And I think so that's going to be about 1.7 million trees altogether. We've got to about, I don't know, about 100,000, I think. So it's still a way to go, but what we're finding is that it's a really good way of engaging staff within hospitals and GP surgeries with the immediate environment. And for some of them, that's an easy way into the wider elements of the environment, such as climate change. So it's a good way of beginning to engage people who aren't necessarily otherwise interested in sustainability. So we do run a lot of courses, and we do these ourselves, but also in partnership with lots of other organisations. So if you're interested in learning more about any of these issues or anything that you want to teach your organisations, or you want to find out more about yourself, then we'd be very happy to welcome you on one of our courses. And that's it from me. Thank you very much. Okay, so now I have to get back to the the list.
I think it's me next.
Fiona. I'd like to welcome Fiona from the Sustainable Healthcare Coalition. Fiona, over to you.
Thanks. I know what it's like to multitask and share and do this. So I want to present what we do in the Sustainable Healthcare Coalition. I'm a doctor by professional background, and I've been chairing the coalition for about 3 years. And I guess the question is, who are we and why did we come together? Well, when the NHS was initially thinking about its sustainability, it realised that quite a large proportion, about 2/3 of its footprint, actually is in its supply chain. And if they were really going to get to the bottom of that, they needed to bring together a group of people, including the private sector, to help them work out what that carbon footprint was and how really to use that to leverage change. So we came together as a coalition. We are growing, but we bring together both large global companies, but also smaller ones, to work with the Greener NHS team and other organisations to really look to see what we can do to accelerate change. So what have we done? Well, faced with that first challenge, we came up with the first global greenhouse gas protocol, carbon footprinting of medicines and devices. And that sounds rather technical and boring, but actually it's one of the key building blocks that you need if you're actually going to try to assess what the impact of a medicine or a device is in a care pathway. But what we realized pretty soon was it was fine to have that as a building block, but that we needed then to really understand how that fitted in to the journey that a patient takes through the system, and that how you use medicine and devices is equally important. So again, we work with a whole range of organizations, the NHS and beyond, in fact, in America, to really work out what the components of a care pathway were. And as you can see, there are things like a GP consultation, patient travel, what it means if you go to an emergency department. And we came up with some figures to really represent those and came up with our guidance. But knowing that that was true, we then realized that it wasn't very accessible for people in the document. And we've come up with an online calculator, which allows you to come up with what if scenarios. So if I have this way of treating my patients, what might the impact be? And we've been using that approach to really work on a number of case studies to show just how you can design in health outcomes, but also design out environmental impact. And for example, one of the case studies that I've got up here really shows how a smart system of using web support and app support for patients as they go through a hip replacement allows us to really improve people's health outcomes, but also make sure that people go home earlier and have less of an impact on the system. Recently, we've been doing work with the Oxford Academic Health Sciences Network to look at early testing in preeclampsia to see the impact that would have on the system. Well, what we've learned is that really, if you're going to affect change, you need to bring together the people who are delivering services and really understand how they work, clinicians, with people who produce the kit, manufacturers, to have an open conversation about why couldn't things change? Why couldn't we make things happen in a different way? And then if you do that, that's really at that sort of patient interface level that you really get the opportunities for innovation and change. So we're continuing to work on some of these building blocks, but we've also been working with the Greener NHS team on the supply chain through the Suppliers Forum, learning from each other, both as companies, but also what UNDP is doing internationally on its procurement approach. We've also begun to look at some of the areas that other people are not looking at. For example, low carbon clinical trials, and we published an editorial in The Lancet recently, and we're working with the Institute of Cancer Research and colleagues and partners from TMRP, part of the MRC network, to really look at how can we come up with a design tool, again, to really consciously design clinical trials to reduce their environmental impact. We've been building on the work that Rachel described with colleagues in Newcastle, with Suren, who leads the haemodialysis services at the Newcastle Hospital Trust, to do a really detailed analysis of renal care pathways and to work with manufacturers to really look again at impact. And as I've mentioned, we've been very interested about how innovation drives change through the work with the Oxford Academic Health Sciences Network, but also working with colleagues in primary care. And next month, we're going to be launching a primary care calculator. And then, of course, we've been working with all the organisations that you're hearing from this evening. And we've also been working with the Climate Change Champions and the Race to Zero team. We're an accelerator organisation for the pharmaceutical sector, and we've been working recently with Prince Charles's initiative, Sustainable Markets initiative, and we are going to be supporting people with a number of events at COP26 and at CleanMed coming up later this year. So we're always looking for opportunities to connect, to collaborate, and really to test and learn, work out what the barriers are, and then work out in partnership together how we can overcome those. So we always welcome collaboration and people contacting us to look for new opportunities. And so many of the things we've done have come from clinicians getting in contact and really giving us a challenge, which we love to then tackle and work out what we can do together. So we look forward to hearing from you, and thank you very much for coming to the webinar.
Thank you very much, Fiona. And now we've got Health Declares a Climate Emergency. Sarah Briggs is going to talk to us. Sarah, are you there?
I think you're on mute, Sarah.
Sorry, fell at the first hurdle. Thank you for having me. My name is Sarah Briggs. I'm speaking on behalf of Health Declares this evening. So Health Declares is came about in 2019 when there was sort of increasing visibility of sustainability and concerns about the environment, and lots of activity from XR, and on the background of an awareness that actually within the NHS, a huge proportion of healthcare workers feel that we ought to be doing much more to support the environment. We sort of identified that there was a role for coordinated mass lobbying from within the healthcare community of the healthcare institutions that both employ and represent us. And we were really sort of inspired by other movements like Culture Declares, which had done quite a lot of work at that point. And we've developed into a grassroots movement of healthcare professionals who are working for increased engagement on climate action. So we have three main sort of requests of the institutions that we're working with. So the first, to declare a climate emergency. Secondly, where they have investments, to divest from fossil fuels. And thirdly, to take action to address the climate and ecological crisis. And the aim is really to both influence health professionals and organisations, and also to enable and empower grassroots health professionals to take a role in instigating change in these health institutions. We provide resources to support people to lobby and enact these changes. So we have resources on how to approach the institutions in the first place, and a connectivity of the network, and resources on how to start conversations around divestment and where you go beyond declaring. We operate on a sort of hub and spoke based model. So we have a central hub of people who are active in sort of organisation of Health Declares, which is based on Slack. And then we have lots of spokes focused either regionally or on particular areas of medicine. So obviously one of the earlier sort of areas in all of this action has been Newcastle, and colleagues in emergency medicine did a lot of early work, but we've then had a growing number of spokes who interact with the hub, and also between one another and learning from one another. So in terms of joining Health Declares, people can sign up on the website, and we ask people to take a personal pledge that matches Health Declares ambitions when they do that. So you can't see those on there, but the first point is recognising that the climate and ecological emergency is a health emergency, recognising that these health impacts are unequally distributed through society, as Students for Global Health were emphasising earlier. A commitment to act in a personal and professional capacity to try and mitigate those risks. A commitment to communicate the importance of these risks to colleagues and decision makers, and a commitment to call on organisations and the government to act on the ecological crisis in keeping with the urgency. So once people have signed up to that personal pledge, we then get in touch with an email and a welcome pack that has lots of the links and resources, and also a phone call, so that we can try and link people up with the appropriate spokes groups. So we have some very active areas at the moment, particularly Psych Declares have done a lot recently, and a very active student group who are working to encourage medical schools to declare an emergency. And that's the web address. So far, been 7 medical royal colleges have declared and taken taken action by setting up sustainability committees and putting policies in place. 11 NHS trusts have declared, and we've got 26 spoke groups working across the UK and over 8 different specialties. We've currently got 110 members in the hub, and over 200 people have signed up to the individual pledge, and a much bigger reach of the network beyond that of people acting within their own institutions. And we've also done a lot of work collaborating with other health and climate organisations, including MedAct and Students for Global Health. And in terms of members, I think one of the things that attracts people is we often find people coming to Health Declares who maybe felt that being involved with non-violent direct action felt like a step too far for them, but they wanted to feel they were active, and this is a sort of form of activism that they feel they can engage with. People are feeling really empowered to speak out with colleagues, and I think with the support of the network, feel much more encouraged to engage with their own institutions and seeing real change being made in their own places of work. So that's us, and we'd be delighted to hear from more of you. Thank you.
Thanks very much, Sarah. That was brilliant. And we've now got Rob from MedAct. Rob Abrams, sorry. Are you there,
Rachel.
Rob?
I'm just going to try and share my screen very quickly. Amazing, that worked. Awesome.
Great.
Hey everyone, my name's Rob. I'm the Climate and Health Campaign and Program Lead at MedAct, and I'm going to give you a very, very quick whistle-stop tour through the work we've been doing with the Health for a Green New Deal campaign over the last year, because I have to actually jump off soon and get onto another webinar, which I'm really sorry, so I won't be around for the Q&A, unfortunately, but I'll make sure there's plenty of links in the chat at the end. So the Health for a Green New Deal campaign, what is that? It's a campaign that aims to build mass support in the health community for a transformative Green New Deal, and to support those working in health to organise for a just transition to a zero carbon society. So what do we mean when we say Green New Deal? It's probably a term you've heard a lot, maybe more in the context of North America rather than the UK, but it's also a growing movement of people within the UK. And what they're fighting for is a 10-year action plan, government level, of policies that are guided by these 5 principal areas of a rapid decarbonisation that gets us away from fossil fuels as quickly as possible. No of this net zero by 2050 nonsense, that is more than useless. We need to do that much more quickly. Creating millions of green jobs and ensuring that there's a just transition for those working in high emission sectors. We can't just leave people working in oil and gas behind. We need to ensure green jobs and retraining. Transforming our economy to make sure that the financial system serves the needs of people and planet. Protecting and restoring our vital habitats and ensuring sustainable food production, as well as ensuring that things like clean water, air, green spaces, and a healthy environment are suitably accessible for all. And most importantly, as Students with Global Health touched on before, promoting global justice and making sure the UK does its fair share in accounting for its historic role in causing the climate crisis disproportionately to many nations around the world. So again, I'm going to say this a few times during my talk, but I'm going to put loads of links in the chat just to remind you to watch out for that at the end. One of the links I'm going to put there is to our recent briefing report, the Public Health Case for a Green New Deal, where we explore some of these policy areas from a public health perspective a little bit more. So what have we been up to in the last year? So about 12 months ago, we coordinated this letter with some of the wonderful, awesome organizations who are also represented on this call today, in which we called on the UK government to, as I highlighted in those Green New Deal principles, to live up to their fair share of tackling the climate crisis and commit to an ambitious voluntary reductions ahead of the COP26 conference, which is now just barely a week away in Glasgow. So that was signed by around 1,400 healthcare professionals around the country, and was also endorsed by 3 Royal Colleges, including RC Psych, RCGP, and the Royal College of Physicians. So what have we been up to more recently? So we've been involved in drafting this really exciting new piece of legislation. That might give away how much of a geek I am. I don't know if everyone here is quite as excited by legislation as I am, but I am. So this bill, the Decarbonisation and Economic Strategy Bill, aka the Green New Deal Bill, which has just been tabled in Parliament, I believe, just under a week ago by these amazing team of MPs that you see here. We ensured that our members were involved in the drafting process of the text to ensure that public health was at the core of this, and that investments in health and care jobs as green jobs was included as part of the strategy of how we decarbonize the UK economy rapidly and create an economy that's based on health and well-being of our communities. So we've also been taking action to promote this bill and put pressure on MPs to back this bill in Parliament. So we've had groups all around the country who've been getting members of the public and their colleagues and friends to sign these postcards, sending them to MPs. And it's been a really awesome month. It's something we're going to do a lot more beyond COP as well. But just to show you some pictures here, I tend to like putting pictures more rather than lots of text in my presentation. Sorry if you're not that sort of person, but here you go, here's lots of photographs, and here's some of our groups around the country in Newcastle and Plymouth, Bristol and Liverpool. Yeah, taking action and getting engaging members of the public, not only on the Green New Deal bill, but also on the health impacts of the climate crisis more broadly, which sounds like it's been a really interesting and educational experience for a lot of people involved. So this work that MEDAC members have been doing on the Health for Green New Deal campaign led to this really exciting moment just about a month ago when the British Medical Association voted to endorse the Green New Deal at their annual representative meeting, which is a massive boost for the movement and hopefully will lead to lots of fruitful collaboration in the near future. So in regards to our actions around COP26, our members in Scotland have been coordinating this really awesome letter calling on world leaders to, do their fair share, to commit to a global just transition and do what is really needed to lift up ambition and spirits ahead of the climate talks in Glasgow. As part of this sort of push on this letter, they also produced this poster and have been using that as an opportunity to do some organizing within their practices and workplaces, bringing out their colleagues in what I think is a really moving display of solidarity ahead of the climate talks. They've also been projecting a message in different public locations in Glasgow, which world leaders cannot ignore. Some of these photos are from the Queen Elizabeth University Hospital. There's one from George Square. And this has been used as sort of a media opportunity to talk to the press and the wider public about the health impacts of the climate crisis, which is very exciting. And also this call to kick polluters out of COP. People here might have seen that actually it was announced this past week that BP and Shell and other companies have actually been technically barred from some of the processes of the COP26 climate talks, because even the UK government is now doubting whether or not their climate commitments are actually adequate or not, which just goes to show just how bad their climate commitments were in the first place. So this brings us up to 6th November, Saturday, 6th November. Health workers and students all around the UK are going to be joining thousands of people who are going to be marching around the world on the Global Day of Action for Climate Justice. We're going to be joining these marches as health blocks, representing the voice of the health community, or representing a voice within the health community, perhaps is more accurate. And we've got health blocks that are being organised in London, Glasgow, Sheffield, Leeds, Newcastle, Liverpool, Brighton. I'm sure there's even a very small one that's going to be taking place in Lerwick on the Shetland Islands, which I think is really also, again, very moving. So I'll put a link in case you want to join us on that. I'll put a link in the chat at the end. And of course, the very next day, on the 7th of November, we're going to be running this event online, the People's Health Hearing, and we're going to be hearing from communities all around the world about the impacts that they have witnessed firsthand of the health impacts on the climate crisis, and also of extractivism, the process of digging up fossil fuels out of the ground and what that has done to the health of their communities. So it should be a really, really just incredible and emotional day. So I really do urge you to join us if you're available at all for any time at all on Sunday, the 7th of November. Beyond COP, our strategy beyond COP is based on this belief that community organizing, deep community organizing, and getting in touch with the things that concern our communities is the way forward, and how we build a strong majority to put pressure on decision makers to enact the laws we need to bring about that Green New Deal that we need for public health. And by way of example, we've got on the left here, we've got our group in Leeds who've been campaigning against the expansion of Leeds Bradford Airport. On the right here, we've got members in Sheffield who've been joining calls from local community groups on public transport. And this is more of a strategy that we're going to be building post-COP, with lots of opportunities for training, skilling up, and learning about running exciting, transformative climate and health campaigns where you are. So if that sounds exciting to you, I'll also include in that list of links the sign up to our email list where you can hear about everything going forward. And I think I'm at time. So thank you very much for having me.
Thank you very much, Rob. That was fantastic. Quick run through, lots going on. And do feel that you can jump off. So I'd like to welcome Elaine from UK Hack to talk about harnessing the power of the health establishment. Thanks, Elaine.
Hi, thank you very much. Yes, so my name is Elaine Mulcahy. I'm the director of the UK Health Alliance for Climate Change, and I prefer the word the health community than the establishment. So it's about harnessing the power of the health community. Oh, sorry, I can't seem to. Can you see my slides?
Yep, it's fine. We can see.
It's I moved. Sorry, it was slow moving on there. So who we are? So the UK Health Alliance for Climate Change is an alliance of health organisations who have a common goal to address the health impact of climate change, and also the impact that healthcare and the way we deliver care impacts on our climate. Our membership ranges from royal colleges, medical and surgical, and other health-related royal colleges, associations, societies, and also some journals, including the British Medical Journal, the Lancet, the British Dental Journal, and others, all with a common interest and a common goal to tackle the health impacts of climate change, and, like I say, the impact of our health service on our climate. And how the Alliance works is by generating common messaging for these organisations that we can all get behind and support, because ultimately we are all aiming to do the same thing. In total at the moment, we've got about 31 members, which is growing all of the time. When you look at the membership of our members and add it all up, it's over about 900,000 healthcare professionals that are represented in total. It's approaching 1 million. There's a lot of people that we're hopefully speaking on behalf of. What we do, so the range of the work that we do at the Alliance ranges from advocacy work, campaigns, shared learning, policy development, and also public affairs and speaking to government about issues that are of interest and importance to our members. In the last number of months and build up to COP26, there's two really key things that we've been focusing on, and this is messaging around commitments to limit warming to 1.5°C, and also to reinforcing the message that you've heard from others about wealthier nations doing more to support more lower income economies around the world, and recognizing that fact that it is the wealthier nations who've contributed more to climate change, but those health inequalities is causing those worse off to suffer more from the consequences of that. And so there really is a responsibility to address that burden. So some of the work we've been doing around that includes coordination of a health editorial that was published in over 220 international medical journals all over the world, including the British Medical Journal, the Lancet, New England Journal of Medicine, and 200 others. And that was all published on the 6th of September. And that really called for those two key things, among other things, within the editorial. That was backed up then by a letter, a healthy climate prescription letter, which we've been working closely with international partners on, the Global Climate and Health Alliance, and the World Health Organization, and a number of others, to try and mobilize the world's healthcare community to add their signatures to this letter, which will be delivered into COP by a team of paediatric healthcare workers who are currently cycling from London to Glasgow to raise awareness about these issues and air pollution. And that letter, at the moment, it's got about 450 organisations who have signed that letter and thousands of individuals. So at the moment, I think when you count up the number of people, it's in the millions, and that is representing that message. So really, really strong message from the world's healthcare community. The letter is still open if you want to add your signature to it, and I'll add a link in the chat. And I'll also put a link about the Right for Their Lives group who are doing that cycle of them, so you can get and support them on social media. Other work that we've been involved, we do a lot of work with partners here today. We work together and we've all got a common goal, common interest, and we approach things in different ways. And we've got different groups that we're speaking to and representing. So this is a really valuable group, and doing things like this where we get a chance to speak to people and show what we're each individually doing, but how we work together is really, really important, so that we can share learning from each other as well. Other examples of the role that the Alliance can play for our members includes, recently, for example, we facilitated a meeting between the UK Cabinet Office, who are responsible for delivering COP in Glasgow, and our members, who are predominantly clinicians and who are really concerned about the impact of running such a huge scale event during a pandemic, and the real health concern in terms of pandemic and the COVID risk associated with that, particularly in Glasgow, where that's a real concern at the moment. So we were able to facilitate that meeting, which enabled our members to speak directly to the Cabinet Office involved in delivering that, and question them on the risk mitigation strategies that they were putting in place. And that was really, really valuable. So that's an example of where the Alliance can bridge that gap. One other thing I'll mention that we're going to be launching after COP is a Net Zero Surgery Commission, which will work with partners around the UK. And this is about looking at surgery, which is a huge carbon footprint in the way we deliver surgical care. We've received grant funding from the Health Foundation to fund a fellow to work in this area and to lead this work. And like I say, we're going to set up a commission and hope we can get some learning and some really meaningful actions to come out of that. So that maybe gives you a flavour of the range of different things that the Alliance does. We are always open and welcome to new members to get involved. I think it's so important that the voice of the healthcare community is part of the conversation on climate change. It's really important, and the more of us that are talking about this, the more impact we will have. So please do encourage your organisations to join the Alliance, get involved in the conversation if you aren't already. We've lots of different rates for different sizes of organisations. We try and be inclusive as possible. Everyone's got the same billing at the table, no matter how big or small your organisation is. And do get involved in our campaigns, and of all of the groups here today, get involved in the campaigns, find what works for you, and get as much information and knowledge as you can. And that's our Twitter handle as well, and our website if you want to find out more. Thank you.
Thank you, Elaine, very much. And last but not least, we have Manraj from the Green NHS programme.
Great, lovely, thank you. I'll just share my screen. So I hope you can all see that. So yeah, last one to go. So thanks so much for this opportunity. It's great to follow on from all those amazing talks. So I'm one of the Chief Sustainability Officers, Clinical Fellows at the Green NHS National Programme, and I'm just going to give you a little bit of an insight of what we've been doing to try and deliver net zero NHS. So why? I mean, I think everyone's touched on this. Climate change is one of the greatest health threats, but importantly, one of the opportunities that we all have to make a change and really harness some of the benefits we can get from tackling climate change. So the benefits to health, the environment, social and financial benefits as well, much like the triple bottom line that was mentioned earlier. Sadly, we are part of the problem, but also the solution. We contribute to almost 5% of UK emissions just as an organisation. But we've got a huge workforce, 1.3, 1.4 million staff, that if we manage to engage, enthuse and equip, can really make some traction and move forward. So the vision of the Green NHS is really to commit, which we've done as of last year, and deliver the world's first net zero health service. And that was really marked by this report in October last year, which is around delivering a net zero NHS. And in that report, it highlights some quite ambitious but hopefully feasible targets of hitting net zero for the emissions that we directly control by 2040. And for those that we influence, like the supply chain that's been mentioned already, and travel of patients and visitors, which is our NHS Carbon Footprint Plus by 2045. So the strategy itself was set out by putting together this expert panel and aimed to do the first really comprehensive carbon footprint of a health system, looked at the projections of if we were to do nothing or if we were to do a huge amount, and then how we get there. So a real national roadmap on how we achieve this with interventions that could be quite beneficial overall. So the carbon footprint itself, and I'm sure many of you have seen and read the report, so I won't go into a huge amount of detail, but looks at this based on the greenhouse gas protocol, so splits it into the scopes. So scope 1 being direct emissions that we can control, such as anesthetic gases, the NHS fleet, and some of our energy that comes from on-site. And then the NHS Carbon Footprint Plus, which is the wider influence that we have. So that's supply chain and including patient staff travel as well. This just highlights that in a slightly different way. So it looks at our actual carbon footprint. A huge amount comes from our supply chain, medical devices and equipment, and then from our buildings and estates, as well as that travel. And the diagram here just shows that actually it's cross-cutting across all of the levels of activity we do. It's not just in hospital, it goes beyond that to primary care, mental health and the community. And these bubbles here show you the hot spots that are worth tackling if you were looking for where to start. So where we are 1 year on, we've just celebrated that, and actually it's good to say that we're on track to reduce our emissions by 1,260 kilotons of CO2 equivalents. And if that doesn't mean very much to many of us, it's the equivalent of powering 1.1 million homes. So we're definitely getting there. This is also highlighted by the fact that there is a groundswell of movement. So 9 in 10 NHS staff support the NHS taking action on climate change. There's a huge green NHS community, which I would really plug and get everyone to join. I'll put a link in the chat afterwards. It really allows people to share ideas and not have to invent the wheel again, and work on what's already being done across regions and trusts. We've also had over 155 trusts and ICSs come up with green plans, and all are to be in place by spring of next year. And there's been a lot of progress with many people on this call, on this webinar, on how we engage with that supply chain. So a couple of highlights. These are the sort of work streams that are part of the Greener NHS national programme. And there's been a lot of work going on, but I'll just highlight a couple of things. So that supply chain, which makes up 60% of the NHS carbon footprint. We've stated that we won't purchase from suppliers that are not aligned with our net zero ambition by the end of the decade, and a roadmap was put forward. I won't go into details because it's publicly available. And this is really important given the fact that our supply chain is global, and it really requires quite a lot of collaboration. Estates and facilities, there's a lot of investment going into renewable energy, looking at lighting and efficiency of our hospitals and other buildings, so smart hospitals coming up. And Milton Keynes is a real great case study for this, with over 2,500 solar panels being put into place. A lot of work on our travel and transport, which makes up 14% of our carbon footprint. First hydrogen electric zero emission ambulance, which may or may not be at COP26, and then looking at our non-emergency patient transport, and really aiming to have that to be a net zero fleet by 2035. There's obviously active travel and a lot of innovation going on, with an example from Oxford University with e-bikes as couriers for chemotherapy. A lot of work around medicines. The anaesthetics departments across the country have done a lot of work with reducing their desflurane use, and primary care incentivization to really prescribe low carbon inhalers. There's work across lots of policy with a recent report looking at overprescribing and the impact that has on carbon emissions. And this just shows that there is movement across the board. So COP26, a really exciting time to engage and drive some bold commitments, and there's a lot going to be happening over that period. It's an exciting time for the Green NHS team and everyone, so look out for what's coming. And what can everyone else do? I'd really say get involved, use this opportunity to engage your clinical leaders or non-clinical leaders, staff, and those patients, and really work together. I'd really encourage everyone to join the Green NHS community, and you can also follow us on all the usual social media portals. So thanks very much. I'm also happy for anyone to contact me if they've got any questions, and hopefully I haven't gone too far beyond time.
No, you are perfect. Thank you very much. We have got time probably for one question. Has anybody got a question they quickly want to put into the chat? I'll just...
One question that wasn't answered yet is Marty wants to know if there's a health block in Southampton. Does anybody know?
I can message Rob on WhatsApp very quickly now, and I'll see if I can find out.
Okay, brilliant. He's got Rob's email, but that would be fantastic.
And another question, which I think we kind of answered, which was a nice thing to end up with, maybe, was if there aren't any other questions, was there seems to be a lot going on. Which organisation should I join? So of course, I mean, we all do slightly separate things. And you should join the ones that are right for you, the organisations that are right for you. A lot of us are collaborating anyway, but most of us do different things. So hopefully we'll have given you an idea of what we do, and you can choose which ones to join.
And one final question, Rachel.
Yeah.
Kate asks, how would you engage staff and patients in an inner city trust?
Who would like to answer that? Manraj, go for it.
Yeah, I mean, it's a really interesting one. I think it would be the same way you would engage them across any other, but from the Green NHS team, it's something that comes across in many of our big webinars, but we've put together a patient and staff engagement pack, which will come out on Thursday. And so if you do join that greener community, then that will all be available to you. And it's a really easy toolkit on how to go about putting some of that in, but that's just one way of doing it, a sort of quick and easy guide.
Fantastic, thank you very much, and thank you to all our speakers. You've all, or many of you, have spoken in the morning and now, so thank you for doing a double whammy. And I hope we can do this kind of thing again. I think we've got another slot sometime in January. We'll confirm the date, and then we'll get together again. Thank you to our audience for being so patient with us all for the last hour, and hopefully you'll get in touch with some of us. There's lots of links in the chat, but you can also look up our organisations online. Hope to see some of you at COP, and take care of all of you.